The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. K2 and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because K2 and Providence Health and Services know that family matters.
You know, nearly half of all Americans have high blood pressure, so knowing how to treat it is so very important. Here to share more about the American Heart Association's updated treatment guidelines, we welcome from Providence Heart Institute cardiologist Aaron Schenkerman. Good to have you with us, doctor.
Thank you.
Let's talk about blood pressure. What is blood pressure, and then what is high blood pressure, and what does it do? What does it cause?
So blood pressure is one of the 4 major vital signs,
right?
And it's a measure of the various forces going through your bloodstream at any time, like a life force, if you will, what keeps us up.
Give me what is a good number, because these are numbers, and sometimes people tune out when it comes to numbers, but these are very important numbers that we all need to know what our blood pressure is.
So normal blood pressure is 120/80.
Yeah.
Elevated blood pressure is anything above 120 all the way up to 129, and then we measure hypertension at 130 or higher. At stage 1, and stage 2 is 140 or higher.
And what happens when we have something very high, when we go to the elevated numbers?
Well, in people, in chronic stable patients, like in an outpatient setting, we will start to talk about treatment depending on somebody's other risk factors at around 130, if that's consistent. And most patients at 140 will start to need treatment.
But why? Like, what would they experience if they didn't get any treatment?
So long term, the risks are increased risk of heart disease, such as heart attack, stroke, cardiovascular death, heart failure, kidney disease, and now more research about cognitive dysfunction as well.
Oh, it can cause dementia, that kind of thing?
Long term,
okay.
Untreated.
So the best way, you said we have new treatment guidelines. Tell me about those.
So, subtle change from the previous guidelines, but
okay.
we've lowered our threshold for treatment. And so it used to be that 140 would be the number where we wouldn't really treat if you were around that or a little bit below that. And now that's 130. But that depends on your medical history. So if you're
and your age, possibly?
Absolutely.
Okay.
That's one of the things in medical history that's super important. So if you're a young person without lots of medical conditions and your blood pressure is 130, what you probably want to do is start exercising more, eating a low-salt diet, talk to your physician, and see if over 3 or 6 months that starts to come down.
Okay.
But if you have other medical conditions, diabetes, if you're an older person, the number that we're going to want to treat you at a lower number. So that 130 to 140 is going to be a target for starting medical treatment.
I know some people who really just don't want to do medication.
Yeah.
What do you think, first of all, is behind that?
I mean, I think there's a lot of things. I think it's hard because hypertension doesn't always have symptoms.
Right.
It's hard to think about taking something into your body from the outside if you're feeling okay.
Right.
You know, if it's not immediately life-threatening.
They can't see what's going on inside.
Absolutely.
Yeah, okay.
So I think it behooves us to really have that conversation and understand what prevention is, right, and why management of these conditions is so important.
Okay. When someone, are there other factors that are involved in bringing up our blood pressure? I mean, you always think of somebody who's angry all the time as having high blood pressure, right? But that's not necessarily the case.
No, not necessarily. I mean, I think we're understanding more and more every year. Hypertension is certainly, probably for many people, a metabolic problem, right? So it has to do with age, weight, stress levels, genetics, and then a lot of other diseases can go along with it, like diabetes, obesity, and some of those things. And so we're still learning some of those things, but it's certainly not just your emotional stress levels that lead to hypertension.
Right, okay. Incredible. And if you take the medication, then you're heading on the road to something better, as in you're going to be feeling better, not even realize it, I would think.
Absolutely. I mean, some people do have symptomatic hypertension. So definitely, especially in older patients, they have more heart failure episodes, they have more headaches, they can have more swelling in their body, feel more tired. But most of the time it's silent. But what you're doing if you take medications and get your blood pressure under control is you're very significantly reducing your risk of adverse outcomes like heart attack, stroke, and death.
Absolutely.
And that's very well known.
Absolutely. We want to tell everyone, if you'd like to find out more about blood pressure and high blood pressure and medication medications that can help, just contact the Providence Heart Institute. Go to KATU.com/Family Matters for more information. Doctor, thank you very much.
Thank you for having me.
All right, we'll be right back with more AM Northwest. Don't go away.